This meeting.
All right, welcome everybody. We'll call this meeting to order. Any changes to the agenda from anyone? The only thing I'd like to propose is that we move the review of the Jefferson County Board of Education letters down under new business, not under public comment, because it's going to be response to letters that we've been received. I think several members have received. Any issues with that? No. All right, so we'll do that. First item is approval of the December 10th, 2021 meeting minutes. Has everybody had a chance to review them? I know Gino sent them in advance.
I move we accept them.
Is there a second?
Second.
Seconded by Elliot. All in favor, say aye.
Aye.
Opposed? Meetings have been approved. All right, we'll now start the public comment section of the agenda. Just a reminder to everybody that the public comment period will be limited to a maximum of 30 minutes, and individuals may speak up for up to 3 minutes. So is there anybody here joining us for public comment today?
See if they can reply in chat, check chat.
Yeah, feel free to put a note on if you'd like to speak.
If not, go ahead and unmute everybody. If you can't seem to get that.
Okay.
No,
Is it because people can't?
Let me see.
You can unmute the people and participants.
Yep.
Individually.
I don't think Bonnie has any comment.
Yeah, I don't
Just
see.
click on their microphone and
The chat box would pop up with something if somebody had a comment.
Exactly. I don't think anybody actually has any comment.
Okay.
I never received any emails or anything this week.
Okay. All right. Well,
I assume there would be, but
yeah, I mean, it does say you must sign up prior to the start of the meeting. So we haven't received that, but I just wanted to
I'd like to be flexible.
extend the courtesies.
Absolutely.
All right. Well, thanks everybody, and thanks for those that have joined us today. Now we'll start into unfinished business update on vacancies with sanitarian and nurse director.
All right, so sanitarian is out. However, we did interview our final 2 candidates for one of the open sanitarian positions. I think we may have found one. We'll do our due diligence on that individual to make sure that we're getting someone really great.
Does this person have any prior, like, going back to that question that we have about,
she
like.
is not currently a registered sanitarian. However,
Okay.
However, she has restaurant experience.
Okay.
She's a restaurant manager. She also is a biology undergrad, so she has a bachelor's of science in biology, which is also a very nice, strong degree for this type of work. And these kids are a great environmental health background.
Right.
So, as far as we go with the nurse director, I posted the position yesterday with the DOP with a very clear job description, what the high expectations are for that
This is
position.
for the nurse.
For the nurse director,
Okay.
yep. And we haven't had any responses yet. It's only been up for since midnight last night. So 9 hours, let's give somebody a chance to
Did we
respond.
put explicitly salaries are set by the state?
Yes,
Okay.
that is not only is that in there, but there's some very explicit language on what the expectations of the position are.
What happened to our nurse? She's still here?
The old nurse, yeah. Were you here last meeting?
She was virtual, so
She
she
was
might not
virtual.
have
You may
caught
not have heard it.
everything.
Yeah,
Yeah,
so
I got cut off of
she
it.
tendered her resignation, what, the 5th of December or something, I think like that, or 6th of December, with her last day being the 10th of December, I think it was.
So when that happens, are you guys doing an exit interview to find out?
Yeah.
100% yes.
You
Yeah.
have
She just, she,
correspond to the exit interview?
she came in and tendered her resignation. That's,
Is that what he said?
there was,
Personnel matter.
yeah, personnel. It was a personal issue. There was medical and things like that going on. So that was the main reason.
All right, well, hopefully we'll have a more robust update on that next
I hope we'll
month
have
and getting some,
a robust interaction with multiple candidates,
Right.
qualified candidates.
Yes.
So that's really the goal.
great. Moving on to DHHR grants.
Dr. Reed has a great one.
So we are waiting to hear a very final on the salary.
Okay, do you want to go on that one?
You wanna-
So, okay, so there was a an incentive grant that was released last October from the state. It was Gilead's decision to avail the health department of it. What it is it's a straight, for lack of a better word, bonus for permanent, full-time employees of the health department for continuing, an incentive to get them to continue in the roles that they're currently in. So that came through this week after all the nightmare with the system for award management stuff. That finally came through. It should have come in last year, but it came through this week. They have a really, really easy billing system that I can bill directly through digital. So I don't have to do this incredible amount of paperwork and scan it in and all the ridiculous thing that used to be done. So we're hoping to pay that out on February 2nd. So between the pay periods or between the paydays, and so that it's easy for everybody to see it. We did we made sure that we withdrew our end of any taxes, the department's end of any taxes out of the grant itself, so there won't be any additional cost to the department that'll come out of the grant. And hopefully it's well received.
How much is it?
So it's about $5,200 per individual.
That's
Oh,
great.
wow, very good.
So not an insignificant amount.
No, that's significant.
Yeah, so hopefully, I
Before
think
tax?
that's pre-tax, yes. So the strangest
Candace,
thing
do
about
Do they
this,
put anything in for the boards?
I believe
Asking for a
it's
friend.
$100. I believe it's $100 a month.
Okay.
Make sure that that's paid. So, that's not an insignificant amount. Like I said, I hope
That's great.
it hits them the way I think it should, and I think it will, and it's well deserved, especially for the longer term employees, but also, to keep them coming back to work on a regular basis. We have a great staff, so
Does everybody
This is
qualify for that?
full-time permanent.
This is full-time, per year, right? Annual.
This is a one-time hit on my
One-time.
account. This is a one-time grant roll. I wish it were annual and something we could include. It's not.
Did they have to be here for so long?
They did not. It's for employees moving forward,
Good.
not for in the past. It's to try to retain. It's what they call, it's actually called a retention incentive. That's the correct term. And that's the way we're trying to use it, by trying to keep our full-time permanent staff
Great.
moving forward. So, because I think you all know that the healthcare industry has experienced huge
Well,
turnover
well, I
right
was
now. A
gonna
lot
see
of
if there's
people are
a
exiting it,
retention.
so.
So in Craig Gillian said,
So Gillian, so I had only been here for 6 days, and she presented it to me and said, what do you think? I think we should go ahead and do this. I then found out at the local health administrator conference in December that surprising to me, many of the counties did not avail themselves of it, which shocked me.
Well, one of the problems is a lot of these local health departments are in small counties and they've got, 3 staff members. And this probably took Gillian several days to do this.
Yes.
It's,
So,
If it's a retention bonus, then they're not going to be paid the bonus up front. They'll be paid it over time, right?
no, I thought the best way is to not do it that way. I think it has a much greater impact in a lump sum going forward than it has.
Are there any conditions, and if it's a retention bonus, couldn't somebody just leave after getting the bonus?
They absolutely could, absolutely.
You should put a clause that they leave it in 3 months.
A
they have to
clawback?
Pay back.
I'm not too concerned about that, to be honest with you. I don't see anything like that happening. So I'm not concerned about that. That is something we considered a clawback. We also considered doing it in installments and doing it. And I spoke to all the different health administrators at the conference. Some are doing it the same exact way we're doing it. In fact, some of the best run health departments are doing it the exact same we're doing it, including Mineral County, which is one of the best in the state.
Which
They're doing
county?
it. What's that?
Which county is that?
Mineral County.
Okay.
Kudos to Gillian.
Yep, kudos to Gillian, 100% credit to her. I signed off, nothing more. She did all the legwork, all the paperwork, and like I said, a lot of the counties, for maybe the reason that Dr. Reedy said, did not avail themselves of it, which surprised me a little bit. Yeah, some question.
No, I have internal thoughts.
I understand completely. So,
Two other grants. One is called the Quick Response Team, which is a response to narcotic overdose survivors. And we had that a few years ago. It never really got its footing. We're going to try again. We submitted the grant in the summer, and hopefully it'll be approved. With that, we will hire some part-time staff to be able to respond. These are people with experience in overdose. Some of them will be people who are in recovery themselves. Also hope to hire a social worker. The state originally, when we put in our money for about $100,000, they said you need to ask for more. You need more. Essentially, you need more. So the social worker, talking to different people at the university who's very involved in this and others, so that's where we really need the help. And that would be for this project specifically, though. It'd be great for the health department to always have a social worker. We get so many calls, really kind of patient navigation things. People have a problem, where do they go? And then the other is that there are a lot of money flowing related to COVID. The trouble is they all overlap so much that it would be a nightmare trying to figure out what service was done under one and what was done under the other, so you don't double bill.
Right.
One of the grants that we've got preliminary notice that we got approved was for addressing healthcare disparities in COVID with minority populations. The three minority populations we've identified in this county are African American, Hispanic, and Asian. Asian surprised
You
me.
don't get special treatment ever.
You will now. Yeah, you will now. And so this will be hiring people who will be really focusing on that. So it'll be the traditional community health worker going out to the communities with some insight to talk about anything COVID related, whether it's helping get vaccinations or now getting tests and all that. And then another piece we put in there, about half the funds will be going with a marketing firm, because it's not so much the mechanics of doing these, it's the reaching people. And the reaching people is not just face-to-face. And so we've not done a large amount in that regard in the past, because it's beyond our knowledge. And of course, this location is very difficult trying to figure out, you don't have one major newspaper, one major television or radio station that, like in the 50s. And then the social media is all over the place, and with different populations, it may be different than I'm accustomed to. So we look forward to that, and so we can get, I don't know if you had a chance to look at it.
Not yet. I've been
Okay,
buried
okay,
since
so
I
it's,
got back, but yeah,
But it's,
I'll plan to look at it this
and we
weekend.
will have a steering committee of different members of the community, including healthcare providers, because it's also about how you get healthcare when you need it. Because the disparities are not just getting tests and vaccines, it's access to healthcare, which their access may be there, but people don't know how to get to it. So we're hopeful for that.
want to let you know that that was a juried grant. That was limited. That wasn't available to every single health department. And Dr. Reedy spearheaded that and did an excellent job and landed something that a lot of other counties went for and did not receive and will not receive. So
How much
kudos
is
to him.
That helps, excuse me.
How much is that one?
That's about 180,000, 160, 180,000.
And the quick respond grant, Dr. Reedy, is that the same as the harm reduction in the past?
It's a little different. So we had two grants in the past. The harm reduction mostly is thought of as a syringe exchange program. And that's something we may go after, but it's become more complicated because of requirement that the county council has to unanimously approve it. The quick response is a little different. So we had both grants before when Dr. Didden was here. There are a lot of, like everything, it's in the details.
Okay. All right, next on the agenda, system for award management.
Up and running and beautiful, and
So this is,
It's a-
sorry,
so system for award management is where you register to be able to receive grant money or be a vendor for the federal government aid
Oh,
in any way,
okay,
or
yeah,
receive
yeah.
contractor money or anything like that through the federal government. You have to have. be
that was the one
registered
that
to
you
them.
had the
So
situation
yeah,
with
they had a
last time.
they
Got it.
had blocked us out and everything, and so I just worked my way up higher and higher and higher through the system for award management with multiple phone calls and emails, and eventually
Right.
landed the right person who was able to take care of business, and
Excellent.
they did.
Excellent.
You spearheaded this.
Yeah, I was on
This
the,
initiative.
yeah, I was on the phone. Yeah, that is so important because if we receive, anything we receive from the state is almost always money that comes first from the federal government. So before the state can disperse it to us, they have to have access to our SAM account, our System for Award Management account, to make sure that we are actually legal to receive those awards. So we wanted to make sure that that was up and running well, and we eventually were able to get it up
Do
and
you have
running
any
well.
idea since how long we were?
We were, yeah, about 6 weeks. And so it slowed down almost everything.
Okay, and is there any funds that came missing because of that?
No, they were just delayed. And the main one that was delayed was the incentive grant.
Okay.
Yeah, that was the big one. And it was just,
So if, without the incentive grant, do you think we would have been delayed longer getting?
no.
this
So no, that had nothing to do with the way the West Virginia was granting to us. It was whether or not they were allowed to disperse the funds to us. And that had already been approved and all of those things. It was just whether or not we had permission to receive funds from the federal government.
It developed a glitch at their end,
Yep,
and like glitches, it's not always easy for people
yeah,
to pick up.
that's exactly what it was. It was at the federal government level. It was at the System for Award Management level. And so without constant prodding, it would have just sat there. So I just prodded until they finally came through.
Thank you.
Thanks. Timekeeping and payroll software.
So that is up and running.
The
It's-
timekeeping part, yeah.
So staff likes it. I like it. It's a lot easier. There's no paperwork involved. It's all digitally managed. It's very easy to use. There's easy sign in.
Explain to us how someone signs in
So
and what the security process of that to sign in is.
you got it. It looks just like that. Almost identical to that. Yep.
I can punch for break.
So what security is there to make sure that it's the actual individual signing?
So there's multi-factor authentication when you set up, and there's routine multi-factor authentication. So every once in a while, we'll ask you to redo your password, send you a code to your phone, make sure that it's you, make sure you sign in again, change your password, those types of things.
So it comes to each
Individuals, yes.
personal phone?
Yes.
Okay, good.
So all they had to do was download the TimeWork software, click on it, set it up, sign in the password, sign in the proper way, and then all they have to do is hit clock in or clock out.
Do you think that's improved efficiencies within the staff?
Incredibly. It's freed up at least one staff member who routinely every 2 weeks would spend anywhere from 12 to 20 hours herding cats, essentially trying to get everybody's paperwork and making sure that everybody's paperwork is in order and following up with all of that. That has all now been kicked back to the individual employee. They can easily manage it through their own timesheet and easily manage it on the website for them. It's super easy for them, and it's all on them, meaning if it's not done by Friday at close of business, they don't get paid. That is the hammer.
Sorry, what was the hammer? I was just-
That they don't get paid if they don't close it out by the end of the pay period. And I haven't had a problem yet. It's just like, it's almost identical to what Ann's showing you right there. It's wonderful. And it's super efficient for the employee, for the individual employee, but it's also majorly efficient for the finance tech. She no longer has to double input. So it just goes right to the payroll system and it's ready to go.
Any other questions?
Thank you.
Well, thank you, guys. All right, we're moving on to new business and with the Cox Holiday, yeah.
Hi, everyone. Good morning.
Good morning.
You should receive the November financial reports, and those are the final reports, and then the preliminary December. And
What's your name again?
my name is Charlie Heilman.
That's right. Thank you.
November, your cash balance was $611,000 roughly. Your total income was $460,000. Expenses, $465,000. That puts you at a net loss of $5,000. Overall, your total income was greater than budgeted by 5%. Your total salaries and wages were on target, and operating expenses were 10% less than budgeted as of November. December, remember this is a preliminary report. The cash balance is $432,000. Total income, $499,000. Total expenses, $32,000. At this point, your income is on target at 51% through December, so you're 50% of the way through your fiscal year. Your salaries and wages are a bit higher because there were 3 payrolls in December. And then total operating expenses were below budget amount by 4%. So December, I do expect some of these numbers to change, especially the income. Just due to the holidays and some PTO time, some of the billings are not in. Billings right now for December wasn't even $40,000. Last month, $145,000. So I think that number is going to change a little bit for next month.
Yep.
When you have the final reports. When you guys looked over the reports, did you have any specific questions about any line items?
Does any of this income include these grants we just talked about?
For
December?
the ones we just talked about, no, it does not. Those will be later in the fiscal year,
But in the current fiscal year.
in the current fiscal year.
All right, any other questions? We need us to accept,
And
approve.
before,
Sorry, go ahead.
I was just gonna say, if you review the financial reports before this meeting and have questions, please feel free to email me, email Clyde, and we'll get you the answers
Right,
here at the meeting.
sounds good. Any questions?
No.
All right, so I guess
So it
vote
would
to
be
accept
except
the
November.
November.
I
We don't
move
have
we
December
accept
yet.
the November financial reports.
A second.
All those in favor say aye.
Aye.
Opposed? Passes. All right, thank you so much. Much more efficient just to do the action right after she gives us all the information.
Yep. Better.
All right, update on COVID-19 activity and vaccinations. Dr. Reedy?
So back in
Thank you,
October, we wondered when the numbers were coming down at the end of October, would they come down from the peak and stay down, or would we see, like the preceding year, an uptick as we got into the holidays, starting with Halloween parties and also the cold weather and indoor stuff. Unfortunately, we saw an uptick, and this was all the Delta strain at that time, the Delta variant. And we and Berkeley County, so almost everything that's happened to us has happened to Berkeley and Morgan and Washington County, Maryland. We had an increase in Delta, went high, as high as we've been in the past, came down maybe just a little bit. But then since December 1st, a dramatic change. Probably, and by testing, it was mostly Delta at first. We used to rarely have more than 40 new cases a day for Jefferson County that were detected. Since December 1st, it's almost always been over 50. And then Since about the 15th, it's been over 100 most of the time.
15th of,
15, excuse me,
50
over
to
50,
100.
over 50 new cases a day for Jefferson County,
Okay.
and now over 100. And actually, since December 1st, if you take all of the cases that we've had since the beginning of this, we had the first case in West Virginia, if you remember. The 42% of our cases have been since December 1st of last year, so the past 7 weeks. And it's Omicron. Right now in the US and in this region, 99% of the cases are Omicron.
How do we test for there's no
So-
difference,
so
right?
that-
How do you know if it's Delta or Omicron?
So we don't know from the basic tests that are done, whether it's the home type test or the PCR test, that just detects that it's Omicron. But if you would a fingerprint, or of course you understand this, I know, but if you look at the actual gene sequences of the genes that are different between one variant and another, they send a sample of each of the labs that are tested positive. A sample of them go to more complex labs. So here it's to WVU.
So we sequenced it.
Yeah, so they are sequenced. It often takes about 2 weeks to get the result of that. So this is not real time. The first specimen that I know of that was positive from Jefferson and Berkeley County was about the 15th of December, collected then. And since then, more and more are positive, and the state numbers are going up. It's not, again, there's a lag from time of collection till the result. So the reported proportions are a much, they're above 90% now for West Virginia, but probably like the rest of the nation, they're up to 99%. So pretty much everything we're dealing with now, based on that, is probably Omicron.
Well, the CDC, which is to me, is not they have credibility issues in my book, but the CDC has admitted now that the tests that have been used, the PCR tests, cannot distinguish between the flu and COVID. They've acknowledged this. So how can any, Walensky has said it on television. So how do you differentiate between Omicron and Delta and whatever? I mean, when you can't distinguish between the flu and COVID.
Yeah, I think that, I'm not sure what you heard or who said it, but
The
indeed,
director of the CDC
so,
is
but I'm not
Walensky.
sure the exact words and the context, but indeed, these tests can tell the difference between influenza and COVID and RSV. And
Well, then you disagree with the CDC's position at this point.
disagree with your statement that indeed these tests can tell the difference.
I'm just quoting the CDC's director.
Well, I don't have that quote, but it's not the CDC director
I'll
I'm
send it to
disagreeing
you.
with, but that's not the case, regardless of who said it. They can indeed tell the difference if they're the correct test and done properly. There's always room for error, but they are reliable tests. And are they perfect? No. But that's true of every laboratory test. There's a whole huge background for understanding that. The difference in the sequencing is they actually go and they look at the individual nucleotides in the RNA of this virus sample and see what it is. It's like the spelling of a name. And if it's the exact same spelling, then you say it's this variant or this variant. And it's
I'll send it to
technology, so send it to me,
Bob. I would.
but if
I'll have
that
the
was
board on it.
stated, it's incorrect. Indeed, for for years, technology's been available that's being used in the laboratories that help detect the difference between different types of microorganisms.
Like you go to do your DNA test and they can figure out your ancestor. So same thing with virus, we do that.
And the ability to do it, increasingly complex laboratory things, but it's become amazingly better with each year as technology's gotten better and knowledge has gotten better. But yeah, I'd be interested in seeing the
I'm so sorry.
the quote because
I'll send it to you.
uh,
Yeah.
indeed
I'll
those
copy the
tests
board
are
on it,
valid.
and Gino, everybody. Okay.
So our numbers have gone up greatly. The vaccination, so the other piece is people will say, well, this is just cases that don't really cause harm. Unfortunately, or fortunately, but people can't see what's happening in the hospitals. You see a picture here and there of New York City or someone that, they're talking about high lines, but as of yesterday, Berkeley Medical Center, of their hospitalized patients, 85 of them had COVID. Now, most of the people who are in the hospital with COVID, they're in the hospital for COVID. They're not there because they slipped on the ice and when they went there. There are some people who didn't know they had COVID till they got there. So some people who slipped were elderly people who had been feeling weak for a few days and were falling several times and ended up breaking a hip. They went in and the COVID was probably why they were feeling weak. But most of the people who are showing up, they're there for respiratory problems. So Berkeley yesterday had 85 cases. Jefferson, which only has a 25-bed capacity, had 17 of their cases in the hospital were COVID. Meritus, 95, Winchester, 162. So of those 4 hospitals, so our local hospitals, 359 people in the hospital with it. That's a huge amount of the burden. Plus a fair number of the people who are hospitalized in Jefferson County are not hospitalized in one of these 4 counties. They're flown elsewhere, Inova, Reston, Frederick, Adventist, all over the place. So there's a good number of people that death rate has not gone up yet. And the hope is it won't. The hope is that even though the case numbers are going up with Omicron, it's not going to be as dangerous because it biologically acts differently, which is a good thing. The people getting sick for the most part are the same people we've seen all along. It's the people getting very ill with it. Mostly it's the people who are older, so 50, 60, 70, 80 and above. There are more people who are young getting sick enough to be hospitalized and occasionally die, but that's still a minority of the cases. It's still more people than we would see with a flu epidemic. Flu epidemics, when they occur, nowadays they're usually brief, a few weeks, and then they get better. This is persisting. So we've had high case numbers since the beginning of August in this county. Some counties didn't have as much, and the rest of West Virginia has not been in the surge that we've been having for a couple months now. They're getting it now. Just as an example, and these are all available on their websites for WV Medicine, Meritus, and Winchester. They give their reports now. So Winchester had, of their 162, 138 of them, or 85%, were unvaccinated. So we are consistently seeing a disproportionate number of people who are not vaccinated. And again, we're talking mostly about the elderly, the group that's most affected without the serious condition. They are the ones more vulnerable. And if you think that, so in our elder population, we'll say 60, 65 and above, there are 70 or 80% of them vaccinated. That if you said vaccine has no effect, you'd expect 70 or 80% of the hospitalized to be vaccinated people. It's the other way around. So
I would challenge that. I'd get
Specific
stats
data?
on that too.
data,
Around the world, that's the opposite. In Israel, 80% of the cases are among the vaccinated because they're the most vaccinated.
so no, it's not the cases that are the issue, it's the,
I mean, the hospitalizations.
well, so what you have to do is look at the proportion of people who are vaccinated that are hospitalized. So
Right.
so we will take Denmark, since you brought that example to me. So most of the people who are hospitalized are elderly with COVID. So we'll just focus on that group. And so this is what epidemiology does, is they say, can we tell the difference in different groups? So one of the things you'd want to know is what percent of the people in Denmark who are over 65 have been vaccinated. If you said there's no benefit from the vaccine, then you'd say that's the proportion who should be in the hospital. So do you remember the article you quoted? So you quoted an article, they talked about, I think 70% of the people in Denmark were vaccinated, who were being hospitalized. In Denmark, the number of people who are vaccinated who are over 65 is 98%. So of course, the group ending up in the hospital, if it's the elderly, because their immune systems are not what they were when they were 17, they will more likely be hospitalized because they don't have the same immune system, just like everything else that happens to us as we get older, falls causing fractures. We just don't withstand the same stresses. So the likelihood of being hospitalized, if you're a person who is in that risk group, being elderly, is much less. And if you look at the curves of the number of deaths and hospitalizations, they are much less now than they were, and there's a marked difference between vaccinated and unvaccinated. But yes, we do see the more and more people who are vaccinated, then that's going to be a higher.
I don't think that's true, Doctor. But
I have a question that's a little off topic. When COVID first came out, there was a lot of discussion as to whether or not children spread COVID as effectively as an adult. What information do you have regarding that? Do children spread COVID at the same level of effectiveness as an adult?
So probably yes. It's hard to do, but I definitely know of cases where, so I look at the big statistics, but I also talk to individuals who have COVID and, if they know where they got it. So children definitely can get it from each other. They can get it from a parent or anywhere, but they also can spread it. So I know of people who, an infected child came in contact with a group, and 5 days later, a bunch of them were sick with it.
Is
Not just
the
had-
mortality rate for children with COVID any greater than the flu?
0.003%. Children will recover from COVID at a rate of 99.997%.
Is that better or worse than the flu?
It's, I don't know whether it's better or worse than the
So it
flu, but
depends
kids
on
don't
each
die from the flu or
flu
COVID.
strain that comes. So the flu is different. Some years the youth are more severely affected because they do not have immunity
I would say
to
that's
prior
right.
influenza. One of the wonderful things about this that was recognized very early, when it was still in China, is that kids were not getting sick with this. And and for the most part, that's true. But in individual cases, it is unfortunately, some people will get sick and get ill.
Well,
with it.
let's talk about kids for a second.
So let me summarize. If I'm hearing you correctly, that COVID is no more dangerous to a child than the flu
Yeah,
or
that's
any
fine.
other
Yeah,
endemic
no,
disease that we have.
That's fine.
More relevant to the conversation.
So I don't have the exact information on that.
But we're
The-
speaking in general schemes. In general schemes, is COVID more or less dangerous in an endemic fashion with other diseases that we have for children or not?
I can't give you precise answers because there's a difference in that flu is episodic. This is not now periodic in this population, it's continuing. And each variant changes what effect it has. And we are now with a variant that's completely different than what we dealt with. And that's true with the flu. So fortunately, the number, and I can get you data on that, the number of children becoming seriously ill is mild. There is another condition, there are two other conditions that we don't have great information on. And one is the dramatic for TV footage of the multi-system inflammatory disease, where a few weeks after having had COVID, children develop all sorts of severe problems with, pains and rashes, and either they become sick. And the other is the chronic COVID syndrome, where people, they just don't return to where they were. And they have a variety of different things. That's a little harder to pin down, but it exists in children as well as in adults. There is some information that it's, and this is preliminary because these are not common things. It's not like the hospitalization numbers we're seeing there. But in children, having vaccination seems to decrease their risk of getting these problems. I can't state that as a fact yet. There's information suggesting that. But it, for the individual child who has problems with it, it can be real. But the biggest concern about children or young adults having this is they then keep it going and spread it. And those who are more vulnerable, some of whom are not old people, will then have serious consequences. In otherwise healthy adults, the post-COVID syndrome, because of the huge numbers of people we're talking about, the country of 330 million people, that's going to be a lot of people. Right now in the Eastern Panhandle, about 25% of people have been diagnosed as having had COVID.
I have a question. So let's say that out of that 25% of people in the county, in Jefferson County, do you have a rough number how many children were infected? Like follow the number of infected from school record, let's just say, you work with quarantine and stuff. Do you have a number?
I can get that number easily enough.
Is it like a mass infection?
So we're not
problem at
seeing outbreaks among groups like the forest fire spreading. So in schools, we've not been seeing cases where 12 people out of 14 in a class get it. And so the various measures are protective of spread within school. Most people we're seeing get it, either they have no idea where it came from, or it's pretty clear who in their social network had it, either sleepover with friends or, and not so much on sports teams like we originally were concerned about. And we see it, but not so much because there is
They
distancing.
healthier kids.
Yeah, and about half of that
So with that
has been
information,
vaccinated, which helps some.
so with that information, can you tell us why the school system would operate any differently with COVID than they would any other endemic disease? If you're saying it's not spreading any worse than the flu does in classrooms, it's not affecting children any worse than the flu in the classrooms, why would the school system operate differently then?
Because this is a pandemic that's affected how everything operates.
Yeah, but is that a rational?
Well,
Well,
and
It's
what-
irrational.
Let me answer. So it's because it's different than the flu, it's ongoing. It overall has a
No,
higher.
hold on. How is it different than the flu? Because I've always known about the flu my entire life, so I don't
So the
understand.
flu comes for a few weeks or a month in the winter and goes away.
Okay.
That if you do happen to keep kids out of school for a few days, it's a small part of the total infective period.
But how do you explain that there's been almost no reported flu cases for 2020 and 2021?
Because so this has been worldwide, and it's because we have altered our behavior. We're waiting to see this year because our behaviors are not as altered. But the flu, the
But yet
tests,
COVID seems to operate in that milieu, but flu doesn't. Maybe it's a case of misdiagnosis.
well, there's no reason to believe there's a misdiagnosis because the
I think
technology.
there is.
There's probably there is some question in the fact that COVID continues to go on, yet all of a sudden flu disappears. Yet flu's been around for.
I'm just trying to understand. I'm trying to
Right.
understand.
So I think that's the discrepancy people are trying to kind of match up, because if the behaviors that are supposed to mitigate COVID, which aren't necessarily, I think some people will say aren't necessarily happening as our cases continue to increase, yet all of a sudden flu disappears. But there's a lack of correlation here.
Is it
So there-
possible because we don't test for flu, but we test for COVID? So
Because-
there's negative, like people have symptoms,
Yeah.
but they get tested for COVID, so they negative. But we don't test for the
So
flu.
many of the
Because you
Urgent.
can't tell the difference.
Oh, no, you could go back to school with the flu.
Right.
Right. But if you test positive for COVID, you can't, but we're not sure that either of them is any worse for each other than.
And now there's masks and stuff for kids, which are killing kids.
Well, let's, if it's okay with the group, because we've got a couple other things, and then we have a section on the Board of Education, the correspondence that we've received and whatnot. And I think this actually probably ties in. Yeah, this
Just
probably
a-
ties in
yeah.
with that. So let's table this for a
two
second.
quick things. So one of the big differences is this is a new virus. The COVID is a virus that the human population has no prior immunity to. We are building that immunity, and the hope is that as each month goes on, whether by having infection or having a vaccination, is we will better withstand this. That's a big piece. And that overall, more people in the population are dying from this than with flu. But that's the end of.
Yeah. Let's finish up the reports. I know Gillian's not here with the environmental stuff, but in that section, Gino and Dr. Reedy, if there's anything else that we need to cover in the various reports.
Yeah, I can do a quick like couple minutes.
Okay.
You ready?
Yeah.
Sure.
go for it.
So we're still looking to fill the office assistant position, so hopefully we'll be able to post that within the next few weeks. Usually have two up there. It's nice to have two. Casey is tremendous, but she can't do it all on her own. The next thing we're looking to do is to take advantage of the high-speed internet system that's already at this office. So there's fiber to this building, and there's also cable to this building. I did not know that when I started here. We are using the tower with a cellular internet system, which is extremely antiquated, first of all. Second of all, a lot of our software is cloud-based. So it totally bogs that system down whenever somebody's on the Zoom, is doing a Zoom, and then, you're trying to download software and interact with software that's cloud-based. So we will be going to that. I'll be pricing that out after we assess, so we have the technology.
So that's going to be like a contract with like Comcast or Frontier.
It may also be with the West Virginia Office of Technology through their fiber system. So we'll have to see. I'm
Price
not
comparison.
cheap, but I do want to get a good price
Right.
for the performance that we'll be receiving. So that's where we're headed on that. So that will change everything. With that, the phone system also runs through that same exact cellular internet system. It's voice over IP. So voice over IP takes up bandwidth. Hopefully by removing our internet from the cellular system, that will increase our phone efficiency and our ability to not lose calls and things like that. And we probably will leave it as it is now, because currently the system is set up where we interact very comfortably, very easily with county offices and county government. So I'd like to leave that system in place. So hopefully it'll just open up by opening up bandwidth, it'll improve the effectiveness of the phone system. Second, I also want to, or finally, I want to thank Gillian. I know she's not here, but she's been an incredible support and has given me a tremendous guidance as I've taken on more and more of the administrative responsibility of the health department. And truly, I could not have had a better instructor, mentor than Gillian. She did it in a very difficult time, and she's been able to pass a lot of that knowledge on to me. So I want to thank her for that. And then one last thing, I want to thank Dr. Reedy for his patient, compassionate, unpretentious service. I believe that the residents of Jefferson County, including myself, have been lucky to have such a dedicated public servant in the position of health officer. Not only has he been a great asset to me as I've been learning the intricacies and responsibilities of public health administration, but he's been personally a great support to me. I do not think we could have had a more qualified, dedicated, or humble individual in the health officer position than Dr. Reedy. And he's a man who truly has the community's best interest in mind. So I want everybody to keep that in mind as we go forward with today's meeting.
Is that it on the reports?
That's on the administrator report. I sent out the clinical report. Obviously, when we have our nurse director in place, he or she can address that a little bit more effectively than I can. But you'll notice that our COVID-19 vaccine totals have decreased from November into December. I think a lot of that's probably holiday related, because I know we've had pretty good numbers for January. So
I've been scheduling for my booster, but people around me sick, so I get scared. I don't want to get my vaccine, so I keep pushing back.
All the more reason to do it.
Come on in. We'll take care of you here. Or
Can you do it today?
Possibly. Yeah.
Are you serious?
Yes,
We
of
have a
course.
clinic
I
this
call all
afternoon.
the time. Nobody.
So we have,
You're calling like the pharmacies and things like
No, I
that?
call
So
You
here.
call here? Oh my
so
God.
They
we,
schedule me
Yeah,
far
yeah,
away.
we have a
So-
clinic this afternoon from 2 to 6.
No, I schedule for next week. I just call
Okay,
them.
good.
Okay.
Okay.
Yeah, so Monday, Wednesday,
You're
Friday
messing
next
with
week.
me.
Monday, Wednesday, and Friday next week we're doing clinics as well. Same time.
Manson,
yes,
Yep, 2 to 6.
that's where I'm going next week.
And
Do
then
you
we had,
need volunteers for that?
So we've been doing pretty well with volunteers so far. None of the clinics have been that large. We're looking at like 25 to 50 people for each, so it hasn't been too crazy.
but it's been consistent,
It has been consistent with all of them though.
3 days a week.
So.
And then the testing has been expanded, right? The states.
It has.
Thank you.
We also took on the responsibility, which is just for ease of our staff, to have access to the testing results. So then when people call and say, hey, we were tired of saying, oh, you need to call West Virginia Labs and all those things.
Right.
We've
Yeah,
Mason has
that's
set us
been
up.
like 90% of the calls that we've been
But when
getting.
you go to,
Then-
when you get tested, you give your phone number and your email, and they can, text you the results or email you the results. So
Yeah,
why
I
are we
think
getting phone calls?
The
Just-
problem is that a lot of the people, like, they forget that, like, the birth date for a lot of them is actually wrong, or people have been waiting and they never send them out from West
I
Virginia
see.
Labs.
But because we have access to the database now,
Ah.
granted us access, we
Okay.
have the front desk staff and also Mason, our front coordinator here, have access to that, so we can answer those questions directly now.
Oh, good.
Since we were being held responsible anyways.
Right.
It's
And,
nice to
you know,
be able
some
to get the
people don't-
answers.
Right.
Some people don't provide their phone number or email. I got a couple of calls where people just didn't write them down,
Okay.
so, for whatever
And then
reason.
how do you verify their identification from a HIPAA standpoint? Is it their
So
name and
we
date of
asked
birth?
their birth date.
Yep,
Okay.
they have information that
Yeah,
they should have provided to the West
Right.
Virginia lab.
Okay.
yeah.
Is that test result coming back any quicker now than 48 hours?
in the, not 48 hours, so it was up to 4 to 5 days. And that was true for most labs, unless it's an on-site lab. But even those had to end up sending stuff out. But it's gotten better in the last week.
Yeah, it has
There's a
been a little
point
bit
at which
faster.
50% of the tests that were done by West Virginia laboratories, between 50% of them were positive. So that's and one day they actually, here they tested, I think, 1,000 people.
More than 1,000.
Yeah, a couple
One day, usually
weeks
it's,
ago.
300 to 400.
Yeah.
a day, but,
Do they all have symptoms or because they require the
Travel.
test to go?
So this was the post-holiday surge where the holidays also led to a problem of a couple days that tests were not available to testing sites.
But it's also test requirements like travel, like if people were going to a nursing home or, depending on where they were going in the country or out of the country. As was my case.
Will the local health department be distributing the mask when those things become
So
available?
we only hear about that from news broadcasts and people calling us if they can come get it. And we have gotten no information that they're going to be distributed to local health departments in West Virginia.
What was that for?
The masks or
Oh,
other things that we've had no information that the local health departments are going to be responsible for that. It's certainly something that health departments don't do. We're not, the place people go get masks right now. My
Send
concern
them
is if
to service centers, visitor center, church.
there are lots of places that could do it, postal service. It's
and have we, speaking of the post service, have we promoted the home test site, where people sign up for their free tests?
We're putting that on today, as a
You are
matter
great.
of fact. Yep.
Awesome.
Have our digital intern from Shepherd
Awesome.
doing
Okay.
website management for us, and we'll connect that.
so that will be helpful for a lot of people to find out earlier if they have it, and then, basically for you, it's one of the
Stay home
many
if you're
pieces.
sick. That's all.
Yep, absolutely.
Mhm.
If you're sick, stay home and stay home at least 5 days. That's the guidance has gotten simpler. I mean, it's much more complicated than that, but that would stop a lot of the spread.
Do you have anything else, Dr. Reed?
2 weeks.
I do not.
Do you have anything, Mason, for prep?
Nothing to add other than, of course, we have the clinics coming up Monday, Wednesday, and Friday. So Jessica Strohs and I have been spearheading most of those clinics. I've just been setting up all the paperwork, and we split the responsibility of getting volunteers for the healthcare side and the non-healthcare side as well. So,
I've heard great things about what you guys are doing and running, so thank you for that.
yeah, you're welcome.
Tremendous job.
All right, well, if that's the end of the reports, we'll go to the final on our unfinished business. Is it unfinished? No, new business, sorry. On the Board of Education letter. So, I think everybody on this board received some of the letters over the holidays from parents continuing.
Do you want to cut off?
No,
You want
this
to
is
keep it open?
public.
Okay, just keep it open. Okay.
And so, received, letters from citizens concerned about the ongoing mask mandates within the school system here. And so, I think, and I know a few of you gave me a call expressing sort of a desire to maybe, well, A, to discuss this, and B, what's within our purview to kind of do something about it. I mean, number one is the fact that, I'm going to reiterate just for the record, the Board of Health does not have the authority to institute or to end the mask mandate in the schools. The Board of Education is its own independent body. It's a group of elected officials. They make that ultimate decision. However, the Board of Health did vote back in August, I think it was, and passed a resolution stating the fact that we believe that it's a parental choice about kids wearing masks in schools, and that it is not the position of the Board of Health in support of the mask mandate that the Board of Education has chosen to institute. But we continue to get communications from the community about people concerned about this. So I thought it was really important for us to put it on the agenda today. Both, number one, I think to do some more discussion about the sort of effects on children, spread and all that kind of stuff. So that's why I wanted to table that part of the conversation so we can resume that. And then what, if anything, this entity, this board would like to do in response to the Board of Education. Because I think one of the things for us, one of the things that I took away with a couple of phone calls I received was the fact that the Board of Education continues to blame the Board of Health and say, oh, the Board of Health, this is the Board of Health mask mandate, and not accepting responsibility for their own decision. And I think that's my frustrating point.
I agree.
Is the fact that if the Board of Education is going to make a decision, then own the decision.
They've inaccurately reported, especially, principals and teachers, that this was a Board of Health recommendation. And that is just patently false.
Yeah, for the public's point, and you guys can correct me, under no circumstance has this board ever recommended to the school board or the school system at all that they mandate masks in the school system. This board has never recommended that, and we've actually passed a resolution several months ago that said that we recommend a parental choice. And then also, Dr. Reedy, I've talked to you for hours on the phone. I'd like you to reconfirm to the public if you've ever recommended a mask mandate to the school system.
I have recommended universal masking.
Have you ever recommended a mandate to the school? It's
I've
yes
not
or no.
recommended their action. I've given my
That's good.
advice.
That's real good.
But I think we continue to feel the, again, the effects of the Board of Education choosing to, again, state that it was a Board of Health action, that it was an action of Dr. Reedy, which is, I think, becoming increasingly, number one is just false. And number two, increasingly frustrating because it's deflecting back on here. And I think, quite frankly, distracting some of the important work that the Board of Health and the staff here have to do every day. Like on the front end of, vaccination clinics and testing and all the stuff that you do with, in addition to all the other day-to-day work in terms of sanitation and what for. So
It's the school board, it's entirely the school system's decision to mandate the mask. We have nothing in it.
correct.
Right, but I have an issue with somebody who's employed by the Board of Health going out and making certain recommendations that could be interpreted as being a Board of Health endorsement of a certain policy. I have an issue with that.
So moving forward, what do we ask Dr. Reedy to do when he come to any public event and spoke for the health department? What do we recommend him to do? Like speak as you represent the Board of Health on what our policy is, or what do you guys have recommendations?
Well, that's a
for
good
Dr.
question.
Reedy to do?
We should open that up to discussion because if Dr. Reedy is going to speak at any given body
No,
meeting.
let's stop. So there's actually another issue. It's another county issue that I'm not going to go into too deep. So let's speak in this in terms of not Dr. Reedy. Let's speak in terms of staff, because there was this another staff member who went to another county board and agency and absolutely made a false statement.
Good point.
So I think my viewpoint on the discussion, and you guys can chat afterwards, I'll just listen, is that if any staff member is going to another
A public event.
public agency in the county, the Board of Health, Planning Commission, county commissioners, any other board or entity, that there's an emergency meeting called prior to with this board, and the context of that conversation is discussed before it occurs.
Or a
That's a
special
good
meeting.
point. Yeah, a special meeting and or that a staff should get written permission from the board to speak, on
We can do
matters.
it. We can do it via Zoom.
Yeah.
We can do it.
Right.
We've all had a special meeting on Saturday before.
Yeah, there'd be some recorded minutes.
Yes.
You're right. You're right. I think that's a good policy.
Other people's viewpoint.
You want to make a motion?
I'd like to make a motion that any Board of Health staff, prior to meeting with any other government agency or board that involves Jefferson County, calls this Board of Health together to discuss the context of their speech or their recommendations or their interactions with that other entity prior to doing so.
Regarding only masks?
No, this is all staff,
All policies.
all
Yeah,
policies.
all policies. And
Before extending, let's be a little more specific, before extending recommendations or guidance by the Board of Health, any staff before providing guidance or recommendations to another public entity, meet with this board beforehand.
Well, these employees do all kinds of meetings with other state agencies and stuff.
But they're not providing recommendations. The issue is the recommendations, because this is where we're getting, you both in Board of Education, and then the issue that David's talking about is that they're extending, in Dr. Reedy's case, his words are being misconstrued and utilized inappropriately. In the other case, from David's example, the information that was delivered was incorrect. And so this is when the Board of Health is providing an actual recommendation that the Board is advised of that ahead of time via a special meeting.
Well, I think I need to understand what somebody recommended before I understand how we're gonna reprimand somebody for.
So
making-
for
No,
example.
that's why
we're not
I wanted to
reprimanding.
read
We're not
this.
recommending anything.
Right.
There's no reprimand. It's very simple. If Gino is going to go speak to the elderly ward about a healthcare issue,
Or the Rotary Club.
or the Rotary Club or something, I mean, I don't know where you want to take it. It's open to more discussion. If it's an agency that is employed by the planning commission, or if it's a 4-H club or something, that's different.
Just to understand that there has to be, everybody's entitled to their personal opinions on things. But what we want to avoid is somebody who works for this Board of Health going out and speaking on behalf of us, who are the board that creates policy for this agency, the health department, and not represent what this board feels on a particular matter.
Actually,
And
but
not
I
speak
take
for
it,
this.
I take it a different level. So I take it as a level to help support Dr. Reedy, because I feel like he went in with good intentions, and then I feel like there were a lot of twisted words, and then he's being scapegoated, and he's
Unfairly being targeted.
unfairly been beat up for the last
Yes.
month. So this is also a level of protection for our staff. It's twofold.
And I think it's like for me, the
Yeah,
defining
I
moment
agree.
is a recommendation, that is done on behalf of the Board of Health. If Gino wants to go to the Rotary Club and talk about all the great work that's being done here, or how to, get your vaccines, or whatever the case is, I don't think that's in our purview, and that's, I think, an intrusion in sort of the day-to-day life. If he's just as a public representative talking generally on the issues and touting the work that the Board of Health is doing. I think maybe our distinguishing line is when there's being an actual recommendation or guidance being provided to another agency that will affect
Their decision making.
their decision making. I think that's the distinguishing factor. So it's what Dr. Reedy's been put in the targets for, and again, restating very unfairly, but it helps provide him the protection and others protection. And it also informs the board ahead of time that if there is something controversial, like, you've always let us know when you are going to the Board of Education, or you haven't been in front of them for a while, but, knowing that it could possibly get misconstrued again, I think it gives us also a level of understanding, the ability for us to understand what the recommendation is and what the action is beforehand, versus then trying to find out because somebody's upset, or like what we were dealing with over the past month with all these letters coming in and whatnot.
Yeah, there's no punishment for staff.
It's not
This
punishment.
is to help staff. If they're going to walk into a political hotbed, this is to help staff. Let's have this discussion before you walk in there. Because, I talked to you at 10 o'clock at night, and there was email after email coming through, and you were sick and trying to handle it. And I didn't feel like it was fair to you.
So what my position has been throughout this is to give advice to the elected leaders, unless it's a specific authority that's left to me. So if there's someone, and I'll just use the case because it's clearly defined in the law, if there's someone with active tuberculosis who won't get treatment, wants to go around and spread it, they're very clear in that case. That's a responsibility I have. It's not the board's responsibility.
Or in case of emergency when the governor, when the governor had an order.
Yes.
So whatever motion would exempt those things. If there's a governor order for an emergency mandate when you take over as a medical director.
Well, that takes that level beyond this body.
Absolutely.
So that's not what we're talking about here. You're absolutely right.
Yeah, and so there's a distinction between me giving advice and recommending something versus, what the recommendation is. And that's something as a physician I do routinely, is I recommend all sorts of healthful behaviors, whether smoking or, what they are. But it's up to the individual to decide, whoever it is that I'm advising. And I give them, to the extent they're interested, I give the rationale for it. And they can say that's a strong recommendation, but they don't want to follow it for whatever reason, either because they have a compulsion, as in many conditions, or it's just what they want to do, such as extreme sports. It's and that's what I've done with the Board of Education and others. I say, this is what I recommend, but I have imposed very few orders. We've been from the very beginning, even before this started, I went to the attorneys and said, what are the powers? And they went through, and we've been very cautious on that.
But
Someone
it doesn't, I understand where you're coming from, but it doesn't work literally when the school board sends text messages out and says, oh, we sent out 2 text messages, sorry, there's wrong. It doesn't work.
So I would call that a glitch, use my earlier term.
It wasn't a
I
glitch.
won't say, I will not accept that that was a
Okay,
glitch.
so
I'm sorry.
so that I
Not a
can,
glitch.
I can say that, I am giving you
Personally
advice
called.
Yes,
as I'm giving my professional public health advice, and this is what it's based upon. I'm not giving my political opinion. It's the public health advice based on what it's based on. And if it's, then, so if the school board asked me, should we allow children to smoke in school, I'd say no, based on these reasons. If they say, what should we do about it? I say, that's your decision.
We,
Right.
But can
We
I
agree
say
with-
something?
we agree with
like-
you.
we agree with you. The problem is we're actually contemplating making a motion because your words have been twisted that much.
Right. If you go as your licensed doctor is Dr. Terrence Reedy, and you give medical advice on your own medical license, no problem at all. But when people twist the word and say that it's our words as these member of the board, then we have problem with it, because that's not what we advise.
But that is just simply the position that we volunteered to do when we decided to be on this board, is
Right, but
sometimes you
Dr.
take
Reedy
the.
can't talk for us.
Right, but sometimes we have to take the criticisms as well as the kudos.
This is,
No, it's not a
this is not a
criticism.
criticism.
It is a mischaracterization of the
Exactly.
Well, but
information.
those things happen in all.
No, I
political-
don't
No,
No.
no, that's.
Sorry.
you cannot do
Absolutely
that.
not.
No,
So
So I'll make a motion. Before any staff makes a recommendation to another Jefferson County board, they shall request that that board provide a list of questions to the staff, and that staff member meets with us as a board with those questions prior to attending any meeting.
okay, so as the person
That's
who's,
a motion.
this is a motion.
sorry,
I second that.
Yeah, okay. I was about to second.
All those in favor say aye.
Nay,
And sorry, was that a nay?
nay.
Okay, so that would be 1, 2, 3, 4 ayes and 1 nay. So I think there's also a specific part of this with regards to the Board of Education and, perhaps some clarification that I think needs to be made from this board. And I'm recommending that maybe we do a letter to the Board of Education on behalf of this board, in which I'm happy to draft that and circulate a draft if this board today takes action on it. Is a letter of communication to the Board of Education reiterating the resolution that was passed in August about the fact that we support parental choice in masks in schools, and that to reiterate Dr. Reedy's comments, in which I'll work with you, Dr. Reedy, on reiterating the recommendation and not the use of mandate. And then, I don't know, third is to also share this communication with all parents.
About fourth, to recant their inaccurate statements.
And a cease and desist order
Or a cease and desist.
request to stop saying stuff that isn't true.
I'm going to make a motion.
So the most, sorry, let me just write, so the motion is we'll create a letter of communication to the Board of Education on behalf of this board, of which a draft will be shared with this board in advance of sending that, and in concert with Dr. Reedy and coordinating with staff to ensure that the language is accurate, to send that to the Board of Education to re-clarify the positions of this board.
to the Board of Education and, you know.
And
staff.
requesting that
To be
they share that with
distributed.
all staff and parents or just staff?
Staff. I
Staff.
think, yeah,
The
staff,
whole
Yeah.
system.
staff,
Okay.
parents, or any affiliated school system.
Okay.
Volunteers, whatever, whoever's associated, you know, does work for the system.
So that's the motion on the table.
So moved.
I second.
So moved. Oh, excuse me. All those in favor say aye.
Aye.
All those opposed? All right, the motion passes. Thank you.
Thank you.
Well, I'll take lead on the writing of it and share it with staff, and then we'll get a draft to this board for their input before sending that out.
As far as your new policy that you just enacted, the one about the restrictions on employees of the health department, since we discussed with various agencies, county agencies, throughout the course of the week, and recommend to them different actions, it's going to be very hard for us to know what you're meaning we can't do and what we can do.
That was the definitive word I used, was a board. So you're going to go meet with a board. If you have a director of pick something call you with a question, that wasn't specified in that motion. It was, you're going to go to a board meeting. You're going to ask that board to give you questions, a list of questions, and you're going to meet with us with those list of questions prior to the board meeting.
It's a board of public, it's including public action by another public agency. If they're calling you saying, I don't even know what a daily, you know, I've got somebody in my office with tuberculosis, what do I do? Well, that's within your daily purview of responsibilities. It's when there's an official recommendation to another board agency that is affecting a public decision.
Yeah, I'll give you an example of something that I understand. So if Becky from the county building office calls Gillian and says, is there a well and septic permit on this lot? That doesn't prohibit that whatsoever. If the planning commission calls Gillian to come speak about questions they have about well and septic permits, Gillian's going to ask the planning commission for a list of questions prior to, and we're going to come here prior to her going to that planning commission meeting. It's a meeting of an entire board. Make sense?
But then it precludes a discussion. It's only a reading of answers.
I don't think you can restrict them from doing those kind of things and asking questions at a planning commission meeting or whatever, because that's part of her job.
We're not.
Let's be
forcing
very
anybody to that.
specific here that this is a very political thing that's going on. Everyone here, I think, probably has a consensus that the school board has overreacted and blamed the health department unfairly. Let's go back and amend this motion and make this basically nothing but the school board at this point, since that seems to be the problem. We do not need to be restricting these employees from being able to do their job.
No, if it's only
only board
rule
meetings.
that law that is written on the county book, then there's no problem. If anything that is only when they speak for this board that I have a problem.
Well, I could amend in a fashion like this that will help Dr. Reedy. I could amend to say any board meeting that was given proper public notice. If there's not a board meeting with proper public notice, then it doesn't hold
Board
weight.
meetings cannot occur without proper.
Right, but
That's why I'm
that's the
saying that.
distinguishing factor. So it eliminates the day-to-day operations of the board and the general advice that they provide. The issue is within the decision-making capacity of public board meetings.
All right, so I would like to amend my first motion by adding the additional language that the restriction only applies for staff if it's another Jefferson County, West Virginia board meeting that was given proper public notice was provided.
I'll so moved.
Second, Jimmy.
Huh?
Second.
Oh, you're making the motion. All right, second.
All those in favor of the amendment to the motion, say aye.
Aye.
Those opposed? Motion passes.
Does that help clarify it?
It does. But it would be helpful if you can jot something down in writing, because it will
Yes.
have our staff.
We can do that. Again, this should not affect your daily operations, if somebody
Can you-
pulling a permit or any of that kind of stuff. This is entirely.
Take the two parts of my motion
Mhm.
that you have on video and block those out and then email those to me.
Mhm.
And then I'll write them down verbatim. That way it's for clarity. Does that make sense?
Okay, yeah, that makes sense.
Because discussion back and forth is always really important for figuring out.
This is not affecting staff to staff conversations ahead of time. Staff and staff should be talking to each other across this county.
Absolutely.
It's the staff to board with recommendations affecting board decisions. That's a delineating factor.
Or
here.
you speaking as a doctor to any resident of Jefferson County. I mean, that's not what we're talking about here. We're talking about where policy issues are made based on certain statements that are made and make sure that they're represented correctly.
If, for example, if you would say the sheriff said the county commission made him do this, county
Right.
commission says, sheriff, you're in that position to do these. So of course, the sheriff's elected, so that's different. Not always-
But it is correct in the sense that the Board of Education is an entity that's elected. You know, so they are their own decision-making body. And so I think our frustration that you're seeing not only amongst this board, but also in the public, but the public seeing it very differently. You're getting hammered by the public for things that you didn't say. They're being misconstrued and misinformed. And so we're tired of seeing that happening to you because it's wholly unfair. But then it's also under our responsibility to make sure that that information is also clarified.
So it is true, I recommended universal masking.
Mhm.
And the nuance in the words are very important. I recommend everyone get vaccinated, which is a completely separate conversation than vaccine mandates.
Correct.
We
You
do not
don't-
have a
but you
vaccine
didn't-
mandate here.
But you'll also sit there and tell everybody to not have a cocktail. You'll also, you'll recommend that we don't have a cocktail, that we don't do extreme sports, that we all wear seatbelts. There's a lot of things that doctors recommend that we all do. We should also eat carrot juice every day.
And you can recommend that, somebody who's 18 years old or above, right, has a choice, and this is what you recommend. But mandating for children who have no choice,
It's a parental choice.
Yeah,
that's
that's a
a
parental choice.
real problem.
But again, Dr. Reedy wasn't the one saying mandate. And
That's
that's
right.
the distinction that I think the Board of Education unfortunately has twisted.
We're
And
here,
there's a misconception
Because
within.
kids wearing masks is child
yeah,
abuse.
but we're here demonstrating that we support our staff and we're protecting our staff.
Right.
Okay.
Yeah, and the nuance of, did the board recommend it? Well, the board can go on, and I read, you were both here when we had the medical marijuana issue. I recommended completely different than the board decided, but,
I voted with you.
but that's.
What was
that's
it?
I don't know. It was
Well,
before us.
Yeah, we can go into that.
Yeah, but what was
It's like, we've got to take back, we still have seconds.
I'll
so,
talk.
yeah.
Going
We
to
don't
few
need-
meetings
we don't need to-
before we make that decision. You don't want to open the can of worms today.
So is
We
it time to establish our
Yes.
next meeting date?
Well,
No, I think we have an executive session.
well, let's do the meeting date and then we'll get to
February.
vote to go into executive session. So are we good with the February 11th date for next?
Sound good to me.
Month?
February 11th? Okay.
Yes.
All right, 9:00, same day, same bat channel. How many people actually know that reference? Do you know that reference?
No,
What's that?
I just
Same day,
wanted
same,
to.
same bat channel, same time, same bat channel,
Mm-mm.
the original Batman.
Oh,
Ah,
Gotcha.
wow, the
I'm
TV
so
show.
not cultural, guys. You need to bring me up
That
to
even
date.
predated me.
Not me, though.
All right, so we're good with that, and then also we'll need a vote, motion on the floor. I'll extend the motion to go into executive session.
You have to establish the reason.
It's
The
discussing personnel.
Does it need to be more specific?
There is no actionable items in this. It's just, I think out of courtesy, that this is something that's best had within executive session and is protected by.
Before the executive session,
Okay, so can we have a motion to go in, or there is, I extend a motion to go into executive session. Is there a second?
Second.
All those in favor say aye.
Aye.
Opposed? All right, we're now in executive session.
Pause.
It wasn't.
All right.
I don't think so. Yeah. All right, we are back from our executive session. Thanks to everybody. One of the things that we'd like to offer up, we obviously had a very robust conversation with regards to a lot of things, particularly the leadership of this organization and some protections that this board wanted to put in place in terms of ensuring that we continue to support the leadership like Dr. Reedy, like Gina, like many others here that serve this county. Sort of from some misinformation or misuse of the information that they dispelled. But we also wanted to publicly thank, actually I want to make a motion to officially thank Dr. Reedy for his leadership and his ongoing ability to manage a lot of different facets in a very trying time, to always have an open line of communication, and to serve this county to the best of his ability. We just want to reiterate that, our thanks for that and appreciation. Is there a second?
Yes, I second that motion.
I'm really third.
All those in favor?
Aye.
So thank you very much,
Thank you,
Dr.
Dr.
Reedy.
Reedy.
I'd like to make a motion.
You're allowed to do that.
Okay. I'd like to make a motion to terminate Robert Bob Custer's employment at the Jefferson County Health Department effective 60 days from now, to give him time to work and complete his project with the Jefferson County Food Safety Board.
Is he an employee or is he a subcontractor?
His employment or contract,
It is a contractor.
however that is.
Okay.
Is there a second?
I second.
Open for discussion.
I think our timing is bad and that needs to be put on the agenda for next month's meeting.
Are you making a motion?
Well, we're in the discussion. There's a motion on the table. We're in discussion.
Oh, so there was a second. All right. I have no comment.
Yeah, I appreciate the desire to provide that 60 days, but I do think we should put it on the agenda for the next meeting, giving 30 days for administrative staff to sort out responsibilities, and so we can address this with probably a little bit more information. But that's just that's my opinion.
There's a motion and a second.
There's a motion and a second. So all those in favor of the motion to terminate the contract and or employment of Bob Custer within 60 days.
60 days.
All those in favor say aye.
Aye.
Those opposed,
No.
no.
So it's
The
3
motion's
ayes.
still passed. Okay. All right. I think that concludes our agenda for today. Thank you, everybody, for joining us, and we'll see you next month, February 11th at 9 o'clock. Motion to adjourn this meeting. Anybody?
So moved.
Second?
A second.
All those in favor say aye.
Aye.
Opposed? All right, motion passes. Thank you all.
Thank you.
Thank you.
Thank you, guys.